Hi, everybody. It's Stacy Sobel with Salon Today Conversations. And who do we have today? It looks like Darth Vader. Who is this?
Well, I'm using the force, Stacy. I'm with you.
Actually, this is Harry Wood, and it's his birthday. Happy birthday, Harry.
Thank you, Stacy.
And
It's
you
certainly
are
a new day.
in the new Van Michael uniform.
I am in one of the Van Michael uniforms for sure. Walking in the salon today looks a lot different than it did 2 months ago. That's for sure.
So you guys reopened a week ago, Friday, I guess. So,
That's right.
And this is part of the new uniform. So talk about what you've got on and when you wear it.
Okay, so thank you for having me on. First of all, I really appreciate it. And so what you see here is you see that we have gloves. Obviously, we all know about those. There's a plastic face shield here that's used when we do shampoos for color and for like at the shampoo bowl to prevent any spray from coming up from people breathing. Everyone is required to wear a mask in the salon, both customers and employees alike. So the best way to prevent the spread of any type of disease is to have both people to have some type of protective equipment to keep the droplets off.
So how has it
particular
been to work in the equipment?
It takes a minute to get used to, Stacy. I mean, after being in the business for 30 years, this is certainly a new day and age. The first day when you go back to work, I had a little anxiety about what was it going to be like and everything else. And, to be honest, I felt very comfortable because our guidelines are so stringent that it made it easy. It made me comfortable. When I went back to the salon, the first thing that happened was they take your temperature before you come in, both employees and customers. So knowing that everybody who comes in the building has had a temperature check makes you feel a little bit more at ease. The salon is asking people to provide their own masks if they have them. If not, we have surgical masks to provide. A surgical mask, Stacy, for the record, looks something like this. There's a filtration system on one side and a breathing on the other. And this simply goes around your ears for the customers so it's easy to do their hair. And this kind of spreads out over your chin. There's a little metal piece there that you can kind of pinch to adjust. And to keep it from fogging up your glasses, you want to set it up high enough so that you can kind of go over it like that. And this is what the guests are actually wearing when they're getting their hair done. And then the stylist, they have able to provide themselves with different masks. What you saw here was a neoprene face mask that I've been wearing for a while, but I've experimented with a bunch of different ones. We also have this particular one. This is called a KN95. This is a hospital grade mask that goes again over your face and over your ears like this. For a stylist, these are a little more comfortable because there's a little room here. It's not like right on your face. Gives you a little bit of breathing room. Again, there's a adjustable nose piece here, and you want to adjust it so that the air flow is not coming up in here and fogging up your glasses. That's a pretty good indicator that it's not actually working. And then there's this is a K90. So this is called a respirator. This isn't a mask. It's a mask / respirator. It's called a respirator because it has this in front of it. So there's a filtration system in there. The K90 actually has a ridge that goes around it that sits on your face a little bit more comfortably. These particular straps you would not want to wear getting a haircut because it goes over your head like this. So it makes it kind of hard to provide a service. But as a service provider, this isn't a bad way to go. It's not a pretty look, but it's certainly safe. You know, but we all like pretty. So, you know, the other mask that a lot of people have questions about, this is the KN95. I'm sorry, this is called an N95. And the N95, again, has a respirator here in the front, has a double filtration system, and fits over your head like this. This was the first one that I bought and used until I was able to get a hold of some other ones. So, you know, between this, the face shield, the gloves, the sanitizer, I feel very proud of our company for making the guidelines and the standards higher than, I mean, we came out of the gate pretty strong. When we got the announcement from Governor Kemp that we were able to reopen, we had gone through, you know, a lot of different scenarios. And, you know, I got to say, I love our management team, our leadership, and our coworkers are certainly, you know, our compliance with what the new systems look like. Everybody's really doing a great job. Every employee is required to do the same thing, which is basically you double sanitize every station that you're in. So my guest comes into the salon, they'll get their temperature checked, you know, they'll sign a waiver, and they'll socially distantly wait in the waiting area. When we come and get them, we have a no-touch greeting, you know, we have a no-touch exit. Before they sit down in the chair, you know, while they're standing there, we make sure that they see us wipe the chair down with, you know, barbicide, sanitizer, those things. And again, when they get up, we sanitize it. So it's done twice. Again, before the next guest comes back down, we'll watch them, we'll do it again. So it's been sanitized twice before the person sits back down. And this process happens both at the shampoo bowl and at the stations. So anywhere someone sits, they are required to clean when they get up. Secondly, what we've done is taken like the capes, and all the capes that I will have for a day for a guest will be put in a plastic bag, sanitized at my station. I'll pull out one per guest so that they can see that it's in a nice,
yeah, it's clean.
It's clean and it's sanitary, and we do the towels the same way. So it's really good. I feel safer.
For the services, what are you doing or not doing? You're not doing blow drying right now?
So we are not doing blow drying temporarily because of the airflow. A virus could be airborne. We don't want to push the air around the room, and we just, you know, for the health and safety of the coworkers, the health and safety of their families, as well as the health and safety of the customers and the customers' families, we just decided to, you know, put that on hold and until we feel safe enough to resume.
Now, you had to make some other modifications. I know some of the complimentary services that you do, like hand massage or neck massage, things that for right now, you spend the time doing something else with the guests.
Well, yeah. So we feel like we supplemented, not replaced, the health and safety standards in the industry, where normally we would be high touch and very service oriented with the high touch. We replaced that with increased health and safety standards. And, you know, I got to tell you, I'm super happy that we did that. And I'm also hope that it's one of those things that actually doesn't go away, because I think it elevates our licensure, and it brings us closer to the medical community as far as being medically graded sanitizing. And, you know, I even had a couple doctors that came into the salon the other day, and they were so impressed with our level of safety standards and sanitizing. They're like, you guys are doing this better than we are. And
that's impressive.
That made me feel really proud of what we're doing. And, you know, I'll tell you, what's really been impressive is the client's responses to getting their services done. I saw a compliment or notice or whatever you want to call it on Nextdoor, the app
Yeah.
Nextdoor, where a customer had come in to the salon and she said, "Oh my God, I couldn't wait to get my color done and get my hair cut. I just went to Van Michael's, and if any of you want to know if it's okay to go, these guys got it together. You will be perfectly fine going there." And that just, I mean, I've worked there for 30 years for a reason, but it made me even more proud to be there now.
So you also work through your you have an organization called Back to You. You work with a lot of cancer patients who, for obvious reasons, have very high levels of concern about safety.
Of
So
course.
how have they felt? Have they been coming back, and how do they feel?
Absolutely. You know, the one thing that there's never been a shortage of is cancer patients, and that's unfortunate. But I do, uh, I'm very happy that the health and safety standards in the salons are higher, because I just had a guest on Tuesday that came in, and you know, she had cancer, and we were talking about when she was going to lose her hair and how we were going to transition her and the time frame and so forth. And you know, she felt so safe being in the salon because of how clean it was. And it just was so nice to see that she didn't feel intimidated about coming into a big salon, because we're working at half staff. So the room temperature was a little bit lower people wise than it normally was, which, you know, for me, it was really kind of nice, especially in that moment to have, you know, that conversation and not have her feel like she was stressed out about anything. Because we're not blow drying and not shampooing and everything, the noise level was a lot lower in the salon too. And that's been a nice change as well. But being able to have doctors and oncologists and oncology nurses send a patient into the salon, knowing that the standards of health and safety are so high, and working with someone with a compromised immune system just made me feel so good about what we're doing. And I truly hope that this elevates what we're doing and what our standards are. I really hope that we don't go back to um, the old way. I love um, the elevated standards. I believe that that will lend us credit moving forward. And I think that in the end, it'll also allow us to be able to charge more money once we get back to a normal routine of business. But again, I hope that incorporating these pieces into the service wheel in the salon doesn't change.
It's certainly an opportunity to really educate clients on how much, getting a license means in cosmetology and how much you do have to study. And, it's a really good chance to educate them about that. And
Agreed. And if you watched any of the news the last couple of weeks before the state started opening up, there's a lot of people who look at us a lot differently now than they did before. I mean, there was some bad hair and makeup on TV. I know they were glad to get back into the salons, and I know we were glad to get back to work. So,
well, I
we
think
took
there's definitely a heightened value for the beauty professional. And I think that that's felt not only by the clients, but the professionals too. They understand what they mean to their clients now.
Yeah, I think that if anything, that the licensed cosmetologist, esthetician, massage therapist, anybody in the beauty high touch that requires a license should feel super good about what they do right now, because they know that people need them and needed them, and they were cut off. And I think that there's a new love between the professional and the consumer, and the professional and the patients that come from hospitals. And I
Yeah.
think that there's just a real big opportunity, Stacy, for us to continue to elevate the industry. And I just love what's happening. And it's unfortunate that what happened, but the end result, everything happens the way that it's supposed to, because it does something more to make things better for the most part.
Now, I know that you're a hugger, so the new greeting and the new salutation must be challenging for you, but how do you greet your customers now?
I mean, hang on, I have to show you. I can't, it's too hard to explain. I think it looks like this. Hold on, I should. I mean, what are you gonna do? You know,
Yeah.
I watched a lot of TikTok when I was out. I was like, I want to learn how to do that foot kick thing. I mean, if we can't shake hands and we can't hug, but at least we can kick each other's feet. I said, you know how the French people kiss? They go right cheek, left cheek. You know, okay, so let's kick right foot, left foot. Okay, this is our new French kiss.
Well, thank you so much for being on today. We love you. And
Love you, Stacey. You guys are amazing. And just for everybody out there that watches what you guys are doing, you've put out so much wonderful content. And, you know, as a licensed professional, I'm thankful that you guys have been working so hard and doing such a great job to continue to bring all of the really valuable, pertinent information to us so that we can get back to work. So thank you.
I really appreciate that. It's been a tough task, let me tell you.
You're doing a great job. All of you guys at Salon Today are killing it.
Well, we're all watching you in Georgia. We're all watching you all lead the way. And I look forward to talking to your boss next week, hopefully, and see what kind of how it's shaping the business.
I will tell you that he made sure that all 450 employees had a job the whole entire time. We never let go of one person. And I've always loved Van Council. I'm even more proud to work with him now than I ever have been. So he's a good man. He runs a great organization, and I'm really thankful to be on his team.
That's great. Well, thank you, Harry. Take care.
Thank you, Stacey.
Happy birthday. Have a great evening.
I'll talk to you soon. Take care.
Okay.
Thank you. Bye-bye.